Hi, my name is Kathleen Monson,
My name is Vincent Apodaca.
And I'm Shauna Welch.
and this is our presentation on appendicitis.
Appendicitis is inflammation of the appendix. This occurs when there is stool obstruction. Obstruction results in distension, venous swelling, and accumulation of mucus and bacteria. When the appendix becomes inflamed or infected, rupture may occur within a matter of hours, leading to peritonitis and sepsis. Pain begins in the periumbilical area that descends to the right lower quadrant and localizes at McBurney's point. The McBurney's point is the area in between the iliac crest and the umbilicus. Patients may also experience anorexia, nausea and vomiting, rebound tenderness, abdominal rigidity, fever, increased white blood cells, constipation, diarrhea. One thing we want to be aware of with our patients is that they will usually be in the sideline position with the abdominal guarding and legs flexed. This picture shows the location of McBurney's point, which is represented by the yellow dot. Diagnosis relies on laboratory findings and imaging studies, which include CBC count. A complete blood cell count will show an elevated white blood cell count. Imaging studies such as MRI, ultrasound, and CT scan may reveal localized distension of the bowel. A urinalysis is usually done to rule out genitourinary conditions which mimic appendicitis.
Zosyn, piperacillin, and tazobactam is an IV antibiotic from the extended spectrum penicillin class. Unicin, ampicillin, and sulbactam is another IV antibiotic used in the treatment of appendicitis. This medication is from the aminopenicillins beta-lactamase inhibitor class. Rocephin, ceftriaxone, is an IV antibiotic from the third generation cephalosporin drug class. Antiemetics such as Zofran and Phenergan are prescribed to help control nausea and vomiting. Pain management is important, so Tylenol can be ordered if needed, or if narcotic medications are needed such as oxycodone or Norco, they can also be ordered. IV fluids are hung to prevent fluid deficits and help relieve pain and prevent further complications. Patients are often kept NPO in case surgery is needed, so hydration is maintained. A common side effect of an appendicitis is constipation, but laxatives should be avoided because they can cause the appendix to rupture. A patient assessment will be done, which should include a full medical history and labs. If a delay in treatment occurs, the appendix ruptures and the result can be fatal. The treatment for an appendicitis is an immediate appendectomy, which is a surgical removal of the appendix. Appendectomies can be done laparoscopically, which allows the surgeon to remove the appendix through 3 small incisions while watching an enlarged image on the monitor of the internal organs. If an appendix ruptures, IV fluids and antibiotics that were administered prior to the rupture decreases the risk of dehydration and sepsis.
Possible nursing diagnoses include 1. Deficient fluid volume related to nausea, anorexia, and vomiting. Because the patient is losing so much fluid or not receiving adequate fluid intake, the fluid volume may become depleted. 2. Acute pain related to inflammation. Appendicitis is really painful and your patient will definitely be exhibiting pain symptoms and need pain management. 3. Risk for infection related to possible perforation of appendix. If not removed quickly enough, the appendix may rupture inside the patient. This will release bacteria into the body and cause an infection. Potential complications of appendicitis include peritonitis, abscess, and sepsis. The most critical step in preventing these complications is preventing the appendix from rupturing in the first place. A ruptured appendix will release pus and bacteria into the abdominal cavity, and the resulting infection can be fatal. To prevent appendix rupture, a patient with appendicitis needs to be diagnosed and treated quickly. It is therefore important that nurses be able to recognize the signs and symptoms of appendicitis, and they should also be aware that patients often present differently. For example, older adults may report less severe pain and they may experience discomfort in the right iliac fossa. Once diagnosed, the patient should have their appendix surgically removed immediately to prevent rupture and further complications. If the appendix is not removed in time, it will rupture. Rupturing releases intestinal contents into the abdominal cavity, which can cause inflammation of the peritoneum. This is known as peritonitis. The peritoneum is usually sterile, so the bacteria released into the abdominal cavity irritates the tissues. This irritation results in an inflammatory response which causes massive fluid shifts known as peritoneal edema. Adhesions may also form because the body is trained to seclude the infection. Removing the appendix before it ruptures is the only way to prevent peritonitis. If it occurs, it can be identified through diagnostic tests and by knowing the signs and symptoms. Signs and symptoms of peritonitis include abdominal pain, tenderness over the area, spasm, rebound tenderness, muscular rigidity, abdominal distension, fever, tachycardia, tachypnea, nausea, and vomiting. If treatment is delayed, peritonitis can lead to abscess formation, sepsis, hypovolemic shock, and acute respiratory distress syndrome. Diagnostic tests include CBC with WBC differential, serum electrolytes, abdominal X-ray, CT scan, ultrasound, or peritoneoscopy. Elevated WBCs due to infection and hemoconcentration due to fluid shift should be a warning sign. Appendix rupture can also cause abscesses to form. The abscesses are painful pockets of pus which are the result of the body's attempt to control the infection. Again, the only way to prevent abscess formation is to prevent appendix rupture through surgical removal. If an abscess occurs, it can be identified through diagnostic tests and by knowing the signs and symptoms. Signs and symptoms of abscess formation include abdominal pain, abdominal tenderness, fever, chills, increased sweating, loss of appetite, and fatigue. Diagnostic tests include ultrasound, CT, and CBC with WBC differential. Should the appendix rupture and the resulting abscess or peritonitis not be treated effectively, sepsis can develop. Sepsis occurs when the infection caused by the ruptured appendix spreads outside the peritoneal cavity. Sepsis is a system-wide inflammatory response to infection, so while peritonitis or abscesses only occur in the abdominal cavity, sepsis occurs throughout the entire body. To prevent sepsis, surgical removal of the appendix should be done before it bursts. If it bursts, the resulting localized infection should be quickly treated with antibiotics and fluids to prevent it from spreading throughout the body. Sepsis can also be prevented by closely monitoring the patient for signs of worsening infection and to evaluate current treatments for their effectiveness. Sepsis can be identified through specific diagnostic criteria. Diagnostic criteria for sepsis includes fever greater than 38.3 degrees Celsius, hypothermia, a heart rate greater than 90 beats per minute, tachypnea, altered mental status, edema, hyperglycemia, a white blood cell count less than 4,000 or greater than 12,000, elevated C-reactive protein, elevated procalcitonin, extreme pain, shivering, shortness of breath, sleepiness, the patient stating that they feel like they might die, pale or discolored skin, and elevated lactate levels. So here we have, to complete the presentation, an NCLEX exam question for you guys to go over about appendicitis. We'll give you 30 seconds to read through the question and decide on your answer, and then we'll tell you the correct answer. All right, time's up. Let's see what the correct answer is. So the correct answer is option number 1, notify the healthcare provider. The rationale for this is that on the basis of the signs and symptoms presented in the question, the nurse should suspect peritonitis and notify the healthcare provider. Administering pain medication is not an appropriate intervention. Heat should never be applied to the abdomen of a client with suspected appendicitis because of the risk of rupture, and scheduling surgical time is not within the scope of nursing practice, although the healthcare provider probably would perform the surgery earlier than the pre-scheduled time.
So that's it for our presentation on appendicitis. We hope you enjoyed it and learned something from us. And
Good luck on your finals!